My name is Jake Nyberg. I'm the Deputy Director of Public Works, and I wanted just to announce a couple of people we have in the room. So I just want to recognize some dignitaries. We've got our Mayor, Paul McNamara, is here. Thank you, Mayor, for being here. I really appreciate that. We've got our Director of Public Works, Joe Gallart, and he's with Fred Cheatham and Jeff Valdivia from our COPS unit. So guys, thank you so much for being here. Like the rest of you, they worked a hard day today. They're going to work a hard day tonight to talk a little bit about something that's all special to us, which is our service providers. And I just wanted to a couple housekeeping issues. We've got bathrooms in the back, just in case anybody needs one. Feel free to get up and take a phone call. Bathrooms are right behind either one of these two doors. We'll take you to a bathroom. There's a big blue button. If you hit it, it'll open up eventually, and you'll be happy. Right next to it is a snack machine if you need any sustenance to keep moving forward. And we've got two exits on either side. Thankfully, like the mayor pointed out, if this was happening tomorrow night, we'd all be in masks, but tonight it's okay. At least there's no COVID tonight, but tomorrow it starts. So appreciate that. And again, we're looking at our service providers, and we've got a nice presentation. We're looking forward to hearing some good guest speakers, and we've got a great presentation for you with that. The big dignitary I got to introduce is our Deputy City Manager, Rob Vandehagen. So Rob, take it away for us.
Thank you. Also, Karen Newell, our housing manager, is also here tonight.
She's leaving us though, so we can forget about right? And also,
I don't think she's leaving us.
We have a sign-in sheet. Does everyone sign the sign-in sheet? No. Thank you. Perfect, because I noticed we have more people with signatures, so you could pass that around. And it's a great way. We want to keep your email updated so we can continue the discussion, send you some materials, and keep you posted on future meetings, which we've got a nice one scheduled for you next year, but I'm going to wait to the end. I'm going to tease it now. Stay tuned for our next meeting, which has got a great topic. So Rob, with that, take it away.
Yeah, so this is not meant to be a super formal kind of meeting. Again, this is a conversation. When we talk about people who are experiencing homelessness, it's a very big conversation. So what we try to do is have these meetings and kind of break up the topic a little bit and really try to focus a little bit more on what's going on in a particular topic. So I'll have a couple of slides here, but then what I'm going to do is I'm going to turn it over to others to come up and talk a little bit. So you won't hear me talking the whole time. So again, I encourage you, if you have questions along the way, don't wait till the end. Just interrupt and ask questions to whoever is up here, because it's supposed to be kind of an open forum. So we go into the next here. So again, welcome. Thank you for being here, especially with the rain. Everything else going on out there. Be safe as you leave. If you have any worries as you're leaving the doors here, whatever, you need some help, let us know. We'll definitely make sure you get to your car fine. Not that I think there's any problems out there, but if you need something, let us know. But again, so tonight we're really going to be talking about the city's efforts to partner with the county and service providers to address the people who are experiencing homelessness. It's really a multifaceted issue. Tonight, again, we're going to be discussing the local service providers and what the county is also doing and how we all play a part in addressing homelessness. The next one, a little bit of the city mission. Really, it's all about partnership. We realize that we all play a certain role in this issue. We come together, we establish these partnerships, and we really talk about the issues and try to collect data, collect information. How do we best help those who are experiencing homeless? We cannot do it on our own. We all have our own professional, roles that we play. We have certain disciplines that we have, and so really it's multifaceted. We all need to come together and look for those solutions that really are going to create these long-term progress that we're looking for, and not just a short-term solution, but long-term solutions. So it's really important that we keep reinforcing this idea and this concept, because a lot of people aren't really aware of what does the city do. So I'm going to talk a little bit about internally and externally. On the left-hand side, the responsibilities of the city internally. We have our policymakers, our city council, and city manager's office kind of play a big role in that. And then we have our quality of life team, and that's where we bring all the different disciplines within the city, different departments. They all kind of come together as a team, and we have that as our quality of life team. And you can see below that all the different departments that are part of that team. You have the police department, the COPS unit, public works, encampment crew, downtown park rangers, fire department, emergency medical services there, code compliance, housing, homeless, and neighborhood services, attorney's office. That's a lot of different departments, a lot of different disciplines that are working together to look for solutions. And together what they do is they also work with outside external entities like the service providers and the county, and coming together to have these conversations. So we meet on a regular basis. All these teams interact with homeless individuals on a somewhat of a regular basis. We collect that information. We really want to find out what's going on. Boots on the ground, out there doing outreach, having conversations. And then they will connect with service providers. Some of the other professionals have different disciplines, and really just, we want that coordination. So externally, so the city is in a position to apply for grants, both from the state and from federal levels. That's something that we can do. So we take those grant funds and we allocate that out to service providers. And by being connected and having those partnerships, we get to hear about what is needed, not just from the state's perspectives, but also from what the service providers do and what those professionals are doing out there on a day-to-day basis. Well, who's missing some funding to accomplish something, right? And so we want to have those conversations, and we really want to connect. We really want to understand what the needs are and what can we do? How do we play a role in that? As a city, we do play a role in that. We have conversations with the county, with the state. We're all working together to try to find solutions. And so it's real important the city stays involved in that. Big part of the funding that we do receive is Housing First. It's kind of tied to that. So there are some providers out there that don't really follow that model. It's a component of what they do. So sometimes that creates a little bit of a restriction there of who we can fund and what ways we can do that. So with that, we're going to kind of dive in, and we really wanted to hear from some of the service providers, give a little bit of background on what they do and who maybe their target audience is, who they're trying to help, what kind of lane might they be in, and just those types of things. I'll let them just kind of run with it, and we're going to go through a different list. I'm not here to put anyone on the spot, but I really appreciate those of you who send me in some slides. And with that, we'll start off with Interfaith.
Great. Thank you, Rob. Hey, everyone. I have Felipe Rios, our Chief Program Officer, and Kendra Mackey, who oversees all our homeless outreach teams here in Escondido. We have 25 slides. We're not going to spend a bunch of time on them,
No.
right? We're going to see how quick. Jake, are you running the show? We're going to see how quick you can click through it. We really just wanted to...
We really just want to let you know that Interfaith Community Services provides comprehensive services, and we really serve everyone in the City of Escondido. So whether it's a family coming in to get assistance, whether it's an individual who's homeless, whether it's someone coming out of Palomar Hospital who needs more intensive care and they need support getting housing, we serve everyone, every community member that walks through our doors. And we provide so if you can move.
Yes, you got it.
No. That probably last. Can you move another one? Oh, that's it? Oh, so you don't have all of our slides? Okay, so
They're really good slides.
You missed it out. So we provide comprehensive services, and our comprehensive services, as they relate, do you want to talk more about homeless services?
Yeah.
Yeah. So our comprehensive services basically say that someone has no wrong door. So you can come into Interfaith. Maybe you're just coming in for a meal, and maybe you really don't understand what's going on with your particular situation. So you can come in, you can have that meal, you can come through, you can get our basic needs, you can take a shower in our facility, you can eat there, and then you can talk to someone in our social services department that will help you access all the other services. A lot of people come through our services. A lot of homeless residents come through our services in a variety of different ways. They can come through that morning meal. They can come through our Recuperative Care Program, which basically is a program that we have over here at 250 North Ash. And now we're expanding it to the Turk Center across the street from our main location. And that program allows an individual who is either suffering from an acute medical condition or acute behavioral health condition. When they're released from the hospital, they have a safe place to go. And that program is actually one of the programs that's here on that journey map. And the recuperative care, if they're actually released from a hospital, they get 30 days where they can come into our recuperative care program. During those 30 days, they receive behavioral health support. They receive case management support. They get to speak to an RN, and they receive medication management support. They get all these different life skills and other services attached. The goal is to get them permanent housing. Well, as most of you working in this community know, permanent housing is not really easy to get within 30 days. So we also partner with a lot of the health plans, and we partner with Whole Person Wellness to provide a longer term stay. So if we have someone who comes in, maybe has no health insurance, but we're signing them up for health insurance, we partner with neighborhood health care, we get them primary care, then we would work with that health plan to maybe extend their stay to longer than 30 days. And what you see up here is a diagram of all the services that are provided, or all the different ways that someone who is chronically homeless and some of our high-end users of our system can get all types of services, even though we're a housing first model.
So to kind of pull back, we're not going to be able to share with you all of the 75 plus programs and services that Interfaith provides. We just don't have the time, right? But we wanted to give you a sense of the scope and the breadth of services that are provided. That's a good thing, right? All of these things, as Felipe just mentioned, when somebody comes into our recuperative care program, are available to them. But of course, we still have a lot of people on our streets. Why is that? Because there's some really big missing pieces. And as Felipe was saying, housing that people can afford with services commensurate to their need, permanent supportive housing. The regional task force estimates that we need more than 800 additional permanent supportive housing units in North County that we just don't have. So it's one of the biggest gaps that we have in the system right now. And as you hear Interfaith talk about creating big new projects and buying hotels to convert into recuperative care centers and looking to create new permanent supportive housing in partnership with the city and other partners, it's because these gaps exist. And if we don't try to fill these gaps, despite all these services, we're still going to have people struggling to overcome homelessness.
Right now, next year, we'll have the ability to really partner with health plans to get individuals another 6 months of housing. But that's the biggest problem. The biggest problem would be if there's no place to place them once they leave our program. So it's really, when you hear about housing first, everybody says, okay, housing first means there's no services. There are services. They're all different kinds of services that we can provide. Everyone may not choose those services, but we can try to get them into whatever services that they need. And it's all about how we engage someone in those services.
So just a couple of gaps for you to be thinking about as you think about our system and hear from our other partner providers tonight. We operate the full range of drug and alcohol treatment programs that receive drug Medi-Cal funding. So they're very well staffed, very well supported. We help individuals with co-occurring mental health conditions as well as medically diagnosed need for addiction treatment. We do that through a 14-day detox, but that detox has to be scheduled and it has to be signed off by a medical doctor as a necessity. And any of you doing this work know when somebody's ready to enter into treatment, you got to get it right then, right away, right? And so we used to have here in Escondido a sobering mats program, a partnership with PD and the city. Unfortunately, that program was closed about 8 years ago. And so there's really a need to create that easy entry point into treatment. We would be able to do it at our current treatment facility at 550 West Washington, but we don't have capacity there. We're out of room. So finding a location to relocate that program and be able to help get people off the streets is a major gap that we see. We talked about housing. We can talk with you more offline if you like about our disability benefits program, SOAR, and the role that plays in helping people access disability benefits so they can afford housing. But those are a few gaps we wanted to highlight. We want to leave time for everyone else, but a couple other items. We brought copies of sign-up sheets for the point in time count. This comes up at the end of January, and we're going to actually be doing this year in a way that will not only just count people, but will connect them to services and potentially housing resources. So we need volunteers. You can sign up using this today or tonight. We always do this in partnership with PD and the city, so we're excited to do that again at the end of January. Brought copies of our annual report with all the information on all the 75 programs, and since you missed our cool slideshow, pick that up if you're interested. And then Kendra brought something else that's probably most practical.
Right. I'm Kendra Mackey, and I support, as the clinical services manager, our outreach team. So in partnership with the city, we have developed a report line kind of to address the need for individuals in the community, either resident owners, business owners, individuals in the community who are seeing homelessness, having concerns regarding homelessness, and are calling the city and saying, what do we do? What do we do? And so try to bridge that gap and do some linkage there. So we do have a report line up. The report line is really not to address any kind of crises. We're not staffed with police officers. Any enforcement issues really need to be dealt with still by the police department. We can't force someone off property. But what we can do is provide education to business owners and residents of the city. And then we can also work with individuals who may be at a place wanting to engage in services. So that way we can kind of try to meet people where they're at. So when individuals in the city are encountering individuals who are unsheltered, they can give our report line a call, and we can go out and try to engage with them at that point. So,
And part of that program is also a Motel voucher program that's funded by the City of Escondido, where we can, if someone's willing and able, we can definitely bring them into the Motel voucher. They can stay there for about 28 days, and then we can get them into the appropriate services and right level of care. And that's to get them off the streets, get them inside, and enable us to be able to case manage them in one place and get them to the next level of care.
And I was just talking with our city partners. I think there was a technical problem with our PowerPoint. It was too darn big. So we'll get that to the team, and then it can be on the website as a follow-up.
Sorry.
So, do we want to distribute? Does anyone want a copy of the phone number to access our outreach team?
Greg, Greg, was that the same what you gave at the city council meeting, the presentation?
Similar version.
Because I mean that version is still on. You can access it through the city website. You go to the city council meeting.
And his presentation that he was bringing tonight is different than what we did at the council.
Expanded version.
Sure. I just want to, before we move off of this, working with Interfaith, and they did a great job of creating this. We want to continue to create stuff like this because this helps us identify some of the missing pieces and some of the challenges that we're experiencing, which is really critical because we want to have these conversations, but we can't have them without some format to do that with. So this is important. This is just one aspect, but we're going to continue to try to build these for other groups of people who are experiencing homelessness and what their needs are. And the point in time count's a big part of that. We're really trying to build a by name list and really try to understand who is out on our streets and what kind of needs do they have. If we don't have a model for them, we need to be working on that. We need to connect those dots, and how do we connect them to services, the right services, and not just put them into some sort of housing. It's not just putting somebody in a hotel and saying, okay, we're going to try some stuff, but you're going to be on your own for a while. That's not what we're talking about. We're talking about giving somebody a place to get off the streets and start that service conversation and start that process. And how do we get them into a model like this? Maybe not this particular model because maybe they're not part of this model. Maybe there's a different model. But how do we get them into it? And which service provider matches really good with them? Right? If it's Interfaith, great. If it's somebody else, it's great. There's a lot of different scenarios out there, and what we need to do is identify them and the people so we can connect those dots. Right? Whether they're youth, elderly, whatever their situation is, we need to understand who they are and what their needs are. And so these types of models, we're going to continue to try to build with our providers and be that partner and really try to see, do we need to go after some funding? Or is the city in the position to go after that funding? Maybe we are, then great, but that's our responsibility to do that. If we're not, then how do we facilitate that? How do we help you go after that funding? So I really like this because this allows us to have that conversation. So the next one. So next, compact. So we can come back up here.
So, hi, my name is Carlos Ramirez. I'm with Education Compact. I'm a program coordinator for our Families First Initiative program. Can you please just, next one. Oh, yeah, so one of our programs that we have for homeless prevention is Families First Initiative. It's for Escondido families that have a child between the ages of 10 and 18 that are at risk of becoming homeless. So main purpose of this program is prevention, helping families before they're on the street, living in a car, needing emergency shelter. So we do have a couple requirements. They do have to be Escondido families. There is an income requirement, but the services we provide vary depending on their situation, so how serious they are. So hopefully we can catch them before they lose where they're living at, and help with things like rental assistance, utility assistance. But if they are literally homeless, we do have some emergency housing funding that we could connect them with, so hotel stays, and maybe connecting them to a shelter or somewhere else that they could stay temporarily. If you could go to the next slide, please. The other program that we have is the Hap Program. This is more focused on homeless individual youth. We have a partnership with the Ymca, and this is for youth ages 18 to 24. It's a little bit more broad for Escondido and North Inland individuals. So this is focused on similar things: prevention, diversion services, helping individuals get back to a stable living situation. I don't technically help with this program, so I don't have all the information, but if you have any more questions, on the last slide, we do have the contact information where you can ask more questions. I did bring some flyers. I wasn't sure how many people were going to be here, so I only brought very few, but I'll make sure to leave them in the back so you can take some. So, thank you.
Thank you.
I think it's the relationships you guys have built in the school systems is just phenomenal, right? You have those connections. Again, it's all about partnerships. How do we connect with those who are having troubles? And that connection to the school districts, we really try to find that out. So if we contact us, and we're really appreciative of that relationship that they've built and the connection they've also built with another provider, the YMCA. So they're really doing some good work out there. You know, we're really worried about the youth falling through the cracks, especially as they age out of school, what happens next. So both those programs are really kind of designed to kind of help those individuals. Move on next. So county.
Good evening, everybody. My name is Matt Brown. I'm an operations manager for the county's newest department, the Office of Homeless Solutions. And we launched last month, just about a month ago. And we're going to spend just a couple minutes telling you about what that looks like as far as the northern region, some of the resources that are online and coming, and really how we're going to augment the existing service providers and processes that are already in place here in the jurisdiction. Jake, you have the next slide? Okay, so this one pager is a little small up there, but it'll be in the back. So it is just a quick summary of the North regions. I think it's important as we kind of tell the story to define terms. Our outreach team consists of a couple components. The outreach street worker that we are referring to up there when it comes to staffing totals, they're referred to as human service specialists. And those are eligibility staff. Those are the ones that are making that first connection to self-sufficiency programs. CalFresh, CalWorks, General Relief, and Medi-Cal in the field. They have been in this jurisdiction for a while, riding with the cops teams, and in other jurisdictions with sheriffs and local law enforcement and so forth. We're adding social workers to them. They're social workers in our teams are more of the case management. So the street case management, where they are really doing that relation building with the individual and getting them through those barriers towards permanent housing goals. And that work has just really taken off here over the last month in our launch. We brought in 10 social workers to support the North regions. One of the things that's different than maybe some of the others that you just heard is that we're not jurisdictionally funded. So one of the benefits that we've already seen is that as a client maybe leaves Escondido on, the 78 and now they're in San Marcos, well, my team's going to go with them. We will float through those lines and really meet those clients where they're at. We brought on, so we have a supervising human service specialist that oversees the eligibility staff. We have a program specialist that has been in this field up north for a while. He's been in coastal, but recently promoted him, and he's really supporting training and kind of that next step in their development as they kind of learn the ins and outs of the work. And then we're bringing on 2 licensed social workers that are going to really work with outreach on the high acuity type clients, those that visit our programs most often, either through law enforcement or behavioral health and so forth. This in the jurisdiction has really just begun. We have teamed up with both Interfaith and Compact. Thank you for touring my team. Recently we just got with Jake and DPW and the encampment crews. So we rode around last week, and really the goal on all that, of course, is to meet the clients where they're at, but it's also to kind of download all that just tremendous jurisdictional knowledge of where the hotspots are, who's out there, what the different needs are. And we really can't do that in silo. We're going to need to partner. So next week we're going with the park rangers. We're going to continue to do that until we have that same kind of working knowledge about who's out there and who's going to need the priority for all of those limited resources that Greg was just talking about. So that's kind of us in a nutshell. Rob, did you want to?
I think that's fantastic. You can already see and already hear about the collaboration, the partnerships. We have some of the public works, encampment crews who go around and we get these service requests out there, and they meet a lot of these individuals out there, and they're struggling. And so by creating these partnerships and driving around with our teams, they can transfer some of that trust on day one. Hey, have you met so-and-so? Hey, this is so-and-so. And they have those conversations, and right away there's a little bit of trust that builds right into it. And so that allows them to hit the ground running. And we really appreciate that partnership because it's really paying off. It's the partnerships we have with Interfaith. So we have a number of outreach teams that are out there doing a lot of good work, because we all know different people click in different ways. You have one person trying to do some outreach, maybe they're not clicking with that person. You have somebody else come in, they have a different personality, and they start to match. And they start to have that conversation. Maybe they have a different background somewhere that they just kind of connect with. And so we really appreciate all the different efforts and the willingness between all the different teams just to go out there and do the work. It's not about this is my area, this is this area. It's not about that. It's about going out there and serving the needs. So I got to meet the team, and they're great. They're great people doing some really good work.
Yeah, so kind of to expand on that, after we get that first initial introduction, essentially that's still very similar to what we would consider a uniformed outreach, right? Either through law enforcement or through an enforcement, like an encampment crew, cleanup, and so forth. We're then going to follow up with those clients that have consented essentially towards next steps, and we're going to go out in a non-uniformed outreach, maybe have different results on the second visit and say, we're still here. What can we do? What are your next steps, and how can we help you meet those goals? So that work has been going on since then.
Yeah, I just wanted to make sure everybody knows, I know a lot of people do, but this is really a big deal. I mean, we've been at this for 3 years, and 3 years ago when we started, it was so siloed and regional, and it's not in my city, and the line draws here. The fact to solve the problem, it really has to work together, and it's hats off to everybody here who's in that. And even the division of labor between county and the cities wasn't all that clear, and the staffs have worked all through that. And I think we're making tremendous progress. I mean, there's a lot of work to do, but we're moving in the right direction. And if you're not that familiar, this is good stuff.
Yeah, and outside of the jurisdiction, just to give a little more context on North Region and as a whole, we brought on social workers to support in their primary focus areas, one in Escondido, one in the unincorporated, generally Escondido, that to join an existing social worker, one in San Marcos, one in Vista, one in Oceanside, one in Carlsbad, one that supports Encinitas, Solana, and Del Mar. So we have coverage all over the region. And with that comes that regional knowledge. It'll take a little while to get it all, but that regional knowledge of all the programs, all of the providers, all of the opportunities out there. So we meet these clients that have some specific needs, and there's streams and programs that we can get them into. Well, that's where we're going to try and that's what my expectation is for them to try and access. So really, and that's countywide. Honestly, this team is based in the north, but we are a county department. So if there's a rental opportunity in El Cajon, we're going to go get it. All right. Thank you.
Thank you, Matt. And to the mayor's point, my hat's off to the mayor and his efforts. This new county team that started with the mayor's effort, and the North County Mayor's Group came together in the ad hoc committee and kind of started that whole process. And so, again, thanks for that effort, because that started something big. YMCA, do we have a representative for YMCA? Okay. YMCA is doing it again. I don't know if anyone else might be more qualified to talk about YMCA than I am, but just real briefly what they do. Again, their targeted group is the youth and emergency shelter. Again, they play an important role in the people who are aging out of systems. The 18 to 24-year-old group. So they do some really good work in the city. They were planning on being here tonight, but they couldn't make it. But again, another partner in this process. Okay, go back one real quick. Again, we have a bunch of information here. We can post this up, but it talks about housing support, continuity support. There's a lot of stuff going on there, and they're located here in Escondido. So we have some contact information so that we can make that all available too. On the next one, please. Neighborhood health care.
Okay. I'm Wendy Vieira. I'm Director of Behavioral Health Operations with Neighborhood Healthcare. Let's see, we've been around over 50 years now. You can go to the next slide. I think we just have this slide. Okay. So I'm not going to read all the things that we do. You can look at that. But basically, we've got 18 clinics, 18 or 19 now in San Diego and Riverside counties. We serve about 78,000 unique people, about 397,000 visits a year. So we're fairly large. We serve mostly the Medi-Cal population, so they are well below the poverty limit, uninsured, underinsured individuals. A big thing that, for purposes of this meeting today, I really want to highlight all the integrated work that we do. So in all of our primary care sites, we also have integrated behavioral health, which means we have psychologists or LCSWs there, being able to provide that warm handoff. We also have psychiatry in, I think, 5 or 6 of our clinics, but psychiatry now through telehealth all throughout. The greatest thing one of the greatest things I think we've done in the last 5 years is we are not a social service agency, right? We provide health care. But we also realize we can provide world-class health care, and our patients are not going to get better if we don't address the social determinants of health and the things that are going wrong. So we recognize obviously that a lot of our patients are homeless or have a lot of essential needs gaps. We've had a relationship with Interfaith for about 15 years. We started out here in Escondido. And interestingly enough, actually Interfaith started our behavioral health department. They used to have a behavioral health component and partnered with us, asked us to take that over, and that became our first behavioral health department before we started integrated. So our relationship has continued to evolve over the years, and I think the number one thing that we do really well is that we continue to ask ourselves, how can we do it better? What else can we do better? And so in maintaining our relationship, we started co-locating Interfaith in our healthcare centers. Because one of the things that we both recognize is that there are access barriers for a lot of our homeless individuals, and a lot of invisible barriers, right, that our homeless individuals have. So, even if we give them the referrals to all these different places, if they have to go across town or catch buses or get a ride, or, I mean, there's just all these different barriers, not to mention all the invisible barriers that we don't talk about. So we thought, well, how best to remove some of those access barriers? Well, why don't we start bringing those community-based partners into our healthcare sites so that we can just do interagency warm handoffs, just walk them right down the hall. In the spirit of, can we do it better? We started writing grants together. We co-author several grants that we've been successful on for many years to be able to pay now for the staff that need to do that care coordination, because none of that is billable services. And so that's evolved to many programs to where we kept saying, what else can we do? Well, even though we've got 7 clinics right here in Escondido, a good majority of the folks that Interfaith serves, so they've got over 100 people living on their main campus every day, right? And then more in the hotels. A lot of those individuals never make it through our 7 centers here. And so we kept saying, what do we got to do to get to those folks? They need us most. And so we put a healthcare center inside their main hub. And so now when all their homeless individuals from their homeless shelter there at Haven House, the residential substance abuse center, they could go right there to get those medical clearances. You know, just like Greg was saying, if they need a medical clearance before they can go into detox, they can just walk them right over. We'll take care of that. A lot of the homeless individuals, because they're so transitory, we need to help them right then when they're there. We can't say make an appointment a week. We don't know where they're going to be in a week, right? So a lot of them have very acute wound issues, podiatry issues, things like that, not to mention mental health and substance abuse issues, and now we can take care of that with Interfaith. So those are some of the things that we're doing where we're just trying to remove all those access barriers and meet them where they're at.
They also have a clinician that works with our
Yeah, we have several. So we have a social worker there, and then we also have a medical clinic with 2 exam rooms. We also provide medication-assisted treatment for individuals with opioid and alcohol
and
dependence.
telepsychiatry on certain days of the week.
Yeah. Okay. Is that all the slides we had? Okay, great. Sure.
When I was first learning about this partnership and this relationship, is very impressive because we talk about barriers and the conversation around these invisible barriers is a big one. And then even when I was meeting with the county team and they talked about the first steps, like you can't get healthcare unless you have an ID. You can't get an ID unless you have a post, someplace you can receive mail. It's all these little things. I can't go get an ID unless I have transportation. I just one step after another. You contact with somebody, you start establish a relationship. Well, how are you going to find that person again? So even issuing them phones and those types of things, all those are little steps along that path to meeting their needs, getting them off the streets, and those types of things. There is so many things that have to happen to get them off the streets. Even like the earlier slide when Greg was talking about the sobering mats, right? If you have to say, okay, come back in 2 weeks and we have a spot for you, is that going to happen? So that's a barrier, right? So we want to kind of look for those things, find those things, work on those things, because those are what's going to provide us those solutions. Thanks. We don't have anyone here from PATH, but I wanted to kind of bring this up. They're another outreach provider. They contracted with Interfaith for this service. So again, it's another. I wanted to bring this up because it's another effort of more outreach, right? We know outreach needs to happen. We need to have these conversations. We need to meet these individuals where they're at, understand their challenges, and kind of keep that conversation going and keep finding solutions and step them through that process. Right? So I wanted just to kind of make note that that's also out there. MHS, I don't think I've seen anyone here for that, but I recently went out and visited their facility and walked through their different programs. And it's quite impressive what they're doing too. They have a clubhouse program, which is kind of interesting. It's just a daily thing that people can walk into if they're having some issues and they're having problems dealing with society. They can go and hang out there, and they teach them life skills, cooking skills. Just they try to do is gear them up to a point where they can get a job, because we know a big part of housing is income and stability and stuff like that. So they try to make sure they have the safe place to come and learn life skills, learn job skills, connect them to employers and those types of things. That's just one of their programs, but they run a bunch of different programs there. So another provider in our city that's doing great work. A lot of their funding comes from the county. So again, it's another partnership. It's not something the city is providing, but we're connecting with all the different providers in our city to try to make sure that if there is a need there, how can we connect the dots? Even when I was out there, they talked about the need of, they're having a little bit of shortage on funding on some things. And we talked about volunteers. We get volunteers that come to the city and they say, I know carpentry, I want to do some volunteer stuff. Where can I do this? You know, and it's another nonprofit where they can maybe come and volunteer. So we're making a connection there that really has, it's somebody who's providing services in our city and somebody who needs to, you know, maybe wants to do some volunteer, do some good work. So again, a lot of times the city is in a position to make those connections. I don't know if there's anybody else that we haven't brought up here that's here tonight that wants to come up and talk about anything in particular in this area. Yes, no, I can't convince anybody else. Really, this is, you know, it's an open conversation, and we're just touching the surface. I mean, if you go back up to the interfaith map thing that we had up here. So if we just talk about every little bit of every one of these services, every bubble up there is a service, we could probably do a whole night on just one of those services and how that works. I mean, so there's a lot of depth to all this stuff that's happening in our city. And so we're really trying to do is get the word out there and get people, if they're looking to get involved, you know, what's the best way to get involved? My recommendation, the city's recommendation is go out to some of these nonprofit, these providers and volunteer there. And really try to get involved that way. They're the professionals. They're the ones doing these things. Sometimes people think that going out to the park and issuing food is a good way to do that. And I think food at some place like Interfaith to allow them to have that conversation with a professional, I think is a better step. Yeah.
And that's for just one population.
Yes.
So that's not all the services that we provide. And there are different journey maps. I think that homeless outreach could do, the youth programs could do collaboratively together, just to have people understand what are the different pathways that someone can go to get assistance. So this was just a project that we put together for health and homelessness, and that's what we worked on for this journey map. But I think it's a great way if all the different providers work together and kind of talk about their pieces and how the county fits into these pieces. I think it's a good way of creating other maps to help support all the work that's being done in Escondido.
I think that's important, that we probably need several journey maps, you know, just
Yes.
for seniors, just for K, just, you know.
Yeah.
They're all different. They have not just, I mean, there's just, we have senior programs too. I mean, there's just so many, it's infinitely more complicated than this.
That one small piece, yeah.
Yeah.
Well, and helping someone is difficult. Because then you gotta throw in there, it's not even a matter of do these resources exist, a lot of them do, but does that person, or are they capable of even accepting the help? Or want it, I mean, it's just very complicated.
I agree. So,
Is there any, so I work up at the high school and we have lots of student groups that are doing volunteering. We've come up and handed out sandwiches before, but like you said, that's maybe not necessarily a sustainable effort to volunteer, but is there maybe a site or QR code or some place where we can go and opportunities for volunteering is posted and information, a resource or contact to just get stuff done and volunteered for?
yeah, so on our homelessness website, it has a list of the many providers out there, and there's links to their websites, and most of those websites have, you want to donate, you want to volunteer, they have links there. So my first reaction to you is we can hook you up with that link to that website, but that's a good place to start there and make those connections. And my example of going out and having these conversations, realizing that there are some volunteer opportunities that we connect. The city also has a volunteer website, and it's open, meaning that somebody can post and say, let's say Interface says, we need some volunteers to do X. You know, we can start to bridge some of those gaps. We can start looking into some of that stuff. But right now, initially, if you're looking for something, I would go to that website and go onto the partners page. And there you can click off to any one of the nonprofits.
I have one more thing.
Yeah.
So we just we received a grant starting January 1st with the 5 high schools here in Escondido. And part of it is that we're going to put posters. We're going to be working with the wellness committees, each of the kids on each campus, and we're going to have posters all over the place with QR codes. It just made me think of that. That as soon, because we're also doing trauma-informed care, which they shouldn't necessarily have to come and tell somebody that they have something to be able to get resources. And so they're going to be able to use those QR codes. It'll be on the school websites and on all the posters. And it will have all the services that we're talking about here that people can access.
You mentioned like barriers, so the homeless community, if you say, go make an appointment for 2 weeks, but if it's like, hey, go to this website, it'll send you around these websites. To me, it looks like almost barrier, a little bit.
No, that's for high school kids that are tech savvy, right? That's why we have walk-in services everywhere for them. You've got to meet them where they're at.
Yeah.
And the flyers in the back for the point in time count have a QR code on there that I tested before I came here. You just jump on there and you can sign up for the event. But then they have to get up at 4 in, so that might speed up the shield with their.
Actually, they need to be at our facility at 3:30.
There you go.
But yeah, so we would like to do more of these because there's going to be some overlap, but we want to understand what that is, and we want to understand those connections, and we want to understand the resources that are needed, and what's the entry point, what does that look like, what kind of barriers are there, and to your point is that's why we put a lot of effort into outreach and trying to gear that up to make sure that we're out there having these conversations. We're not expecting them to call 211 or navigate some websites and all this stuff like that. That's on a we can't expect them to do that. So, but I think even comments like this, who all knows about this? How do we get that word out, right? How do we network together better, right? And that's what we're trying to do. And so I'm thrilled that there are a lot of providers here, and we're having these conversations, and we're starting to create stuff like this. This tries to pave the road to, what are we missing? How can we work together better? How can we do these handoffs? If we have outreach and we come across somebody, YMCA has a perfect program for you. I need to connect you there. Not necessarily within their own, like if it's interfaith doing some outreach, maybe their program isn't designed for that, right? So we need to understand who's out there and who's doing what and how do we make those connections.
Rob, I apologize, I might put you on the spot on this one.
All right.
Okay, but we've had conversations with the Seniors Foundation, and one of the things they pointed out to us was, aside from we need more senior centers, and how many senior orphans there are out in the county, is that about 30% of them are on the verge of homelessness. And the first place to go is the car. And I'm not sure that we're really addressing that yet. I mean, not like we don't have a full plate, but any thoughts?
Well, I don't have the answer to that, but there are a lot of conversations that are starting up around that. And one of the things that we talked about when we finished this is we should do one on seniors. We should do one on youth. Those are our next two that we really should be looking at and seeing what that looks like. Is our outreach finding those people in the cars? It's
the fixed income senior who suddenly is $100 or $200 short to make the rent, and they can't stay, and then they're out the door living in the car.
Slippery slope. If we can catch them before that, we can
Right.
financially assist them and keep them in their current living condition, and that's the better model, right? How do we catch them before that point? And we need to figure that out for sure.
So a variety of programs have homeless prevention dollars. So those homeless prevention dollars can help assist keeping them in their homes. What it doesn't provide, I think the report for seniors said that most seniors need a shallow subsidy of about $300 per month. So that homeless prevention does not provide, indefinite resources. It can provide a few months of resources for those seniors, but it's not going to provide the indefinite resources.
And one of the things that the city is doing, we actually just closed, we're trying to make more permanent housing for our seniors, affordable housing. So today, we closed on a loan so that we will be building 50 new units for seniors, half of them being homeless seniors here in the city.
So that means you can't leave, Karen.
And I think that's the big ticket, is that permanent, supportive, affordable housing. I mean, that's the ticket. Because if you don't have the either permanent supportive housing, which is housing with services, people can fall back into homelessness, because they're gonna need extra supports. And they're gonna need extra supports even when they're housed. And seeing, affordable housing is the other big ticket, right? How many affordable units can you place in a city where people can maintain their rent and they can go up to a certain level and continue to move up? And for seniors, they're always gonna need a certain type of subsidy. So providing that affordable unit for a senior allows them to be able to take care of all their other needs.
Yeah, and I think even to the point that was made earlier, if we're expecting our seniors to find a website and connect to whatever is out there, there's a gap there, right? There's a barrier there, right? And then are we going to expect them to go to our community center and find out there? Maybe some will, and hopefully they do, because there's a lot of other benefits that are associated with that. But if they don't, how are we connecting with them? How are we identifying them? And we need to do some work in that area. At least I'm not fully aware of all the work that's being done. And so to your point, Mayor, I think we have some work to do from a city perspective to help try to connect some of those dots.
Yeah, I mean, honestly, I think there's an education gap. And then there's also pride, I've worked my whole life, I'm retired, I don't need any help until it's too late. The other thing is the affordable housing, which is, by affordable housing, we're talking RHNA, Regional Housing Needs Assessment, percentages of average income. I mean, I'll be honest with you, that's not just Escondido, that's a real struggle to get the developers to come in and do that. I mean, the track record is not very good.
The other thing could be if you see a senior in their car and they're living in a car, making sure you call, Adult Protective Services. There are programs through them as well to help seniors get back into housing, to get them into a hotel in the meantime. In case management, Interfaith has one of those contracts for
And this number you handed out would also be good, right? Yep. I mean, you don't know anything and you're walking in the park and you see somebody sleeping in their car.
There's a number at the bottom on mine as well. This will reach us, and we're all kind of looking at what programs are out there for diversion, if we can catch it fast enough, or for rehousing if we, if they're. So that's another way to reach us.
Does your team also have a subsidized program?
So
it sounds like that's really.
When you talk about APS and so forth, IHSS, they're all county funded. So we will access them. The team on the ground does not yet have available flex funding to kind of bridge some of these gaps. We're using jurisdictional funding where available or through the providers, but it's coming. We're just working out how to track and utilize it, kind of in an equitable manner across the region.
Yeah, because a lot of those programs, county programs, have long lines, right? And I'm not talking physical, but literally you're going to be waiting months, maybe years, to get some kind of a subsidy assistance, right? Especially when it comes to housing, I think, because that's probably, I agree, that's the big ticket. You got to start with that. The seniors, I probably never would have thought of that either, and I agree. And I think that's the big thing, and I think it's great that you have all these community services, but I think, the county, the city, they need to step up. That's just my opinion. I probably don't know everything, so I think that's where the programs need to really be the strongest.
Without housing,
Right.
and with a lot of great outreach workers,
Right.
we're just going to have really great relationships.
Right, that's what it sounds like to me.
Not my line, it's my colleagues' line.
And I will say, I am happy to hear about the county program. We came to one of these, weeks back or maybe months back, I don't know. And I remember one of the things you mentioned was there'll be a homeless person here, and literally the boundary line of assistance is like a block over or even less, where they're like in a certain area under a certain bridge that's county, not city. We can't do anything here. And so I think that I am very happy to hear about the county being more involved, especially in this area.
Well, and I think the other piece of it is educating the community. Like, people hear housing first, and it's like, oh, we're going to give people free housing, and we give them no services. But there are all kinds of services. So it's really about, and you can provide services at different times. Some people may not want to access service while they're street homeless, but they will when they're housed. So I think that's the other piece of the puzzle, is making sure that, you know, housing doesn't become such a bad word that everybody's like, oh, well, we want to give everybody free housing. Housing's actually a good word, right? It's what people need. So wherever we can get them services is where we get them those services.
Probably, let me just add something. The county's gonna go back to the board in response to Supervisor Anderson's request a few months back in the beginning of the year, and they're gonna present, the department's gonna present essentially, and this is for East County unincorporated specifically, so maybe not jurisdictionally, you know, beneficial right here. But they're gonna present a list of all kinds of housing solutions, from, you know, safe parking to tiny homes to pallet to congregate to, and then kind of a cost analysis on, you know, what is the life expectancy of one unit and one cost, startup, staffing, case management, services, and so forth, to kind of look at, you know, as funding becomes available, and, you know, if this is, from the county's perspective, this is, again, in the unincorporated area, but how can we build out that portfolio of resources? Because one size doesn't fit all with the needs out there. And as we've looked at transitional pieces towards more permanent supportive housing, there's a big gap, especially in the unincorporated. There's literally nothing in the east and northern unincorporated. So we're gonna see a lot of movement on that over the next year. And I hope there's a lot more options out there for all of the providers to access here over the next year and a half.
Yeah, and I think, you know, the work that we're doing in outreach and the collaborative work that we're doing collectively is going to give us that information of meeting the needs, right? These are our needs. This is what we know that's out there. The concept of by name list is we're getting to know an individual. There isn't 400 homeless people in Escondido. We know who they are. This is this person, this person, this person. We're understanding who's at risk, who's becoming at risk. Because if we could say like that long list of stuff that you just talked about, to me that just sounds very expensive. But if we can get them before they're unhoused and keep them in there and just a small subsidy, that would go a long way. You know, instead of catching them when they're on the streets, now we have to find that path back. It's very difficult. So there's a lot of work to be done, but there's a lot of good work happening. I'm very excited about it. If you click over to the, let's go ahead and minimize this, and the PDF at the bottom. So Regional Task Force on Homelessness, they put this out, and if you guys haven't seen this, we'll have a link off our website on this. And it just resonated with me, kind of what we're talking about here. If you go down to, I think it's like page 6, this right here, the strategic goal, this really hit home with me, because when I was looking at this, it talks about building a system that's going to produce results, and it's going to create a loop of improvement, right? So we're going to go through this, and as they build capacity, and then they collect data and information that we're all working off of, and then it builds a reputation that they're the experts in this field because they understand what's going on. They provide guidelines and strategies and best practices. Then they can really start to go after some resources, right? So depending on each of the different groups and that we're looking at trying to solve these problems for, we can start to go after certain resources with certain strategic goals, right? And then at the very end, we're gonna elevate the advocacy to action, really. And that's an important part, because we can have all this great information, we can know all the problems, but until there's action associated to it, we're just now in a position to do something, but we need to do something. And then it comes back around to the beginning part again, is now we have some action, we have some resources, now we need to build that capacity, and we need to go back through this again and again and again until we finally start really getting to that point where we're actually making some solutions, but some solutions that are getting people off the streets, not just for today, but long term, right? It's permanent housing, right? It's solving it. Homelessness is supposed to be temporary, in nature. It's going to happen. We can't always prevent it, but when it happens, it should be rare and it should be temporary in nature, right? So if you don't get a chance to read this, we're going to have this up off a link off our website, but you can always go to their website. There's a lot of good information in there. Does anybody else have anything else they want to talk about in the back?
I just have a question. I mean, I've basically seen so many efforts from so many different directions. My question, I think it's a hard question, strategic, well, you mentioned these 5 strategic goals. My question is, how do we measure success? The first thing we have to do, obviously, is have consensus on what success is, right? Defining the strategic goals. With so many different groups and with such a difficult, transient customer, do we have consensus on what our strategic goals are, number one, and number two, do we measure that? Do we have some objective way of measuring that we can look at year over year and say, hey, we're spending a lot of money, we're doing a lot of things, and we're getting better. We're having better success year over year, or we're going backwards. Do we have a measurement like that?
That's a big question, because it could be a question about Escondido. It could be a question about a particular, provider. It could be a question for the county. It could be a question for the state, right? And so, this is, San Diego County, what are we doing here? And the importance behind this is we need to collectively come together, because there's no way Escondido by itself is going to solve this. But how do we measure that success for Escondido? I think the point in time count is an important piece, right? Because what that starts to produce our by name list, then we start to know who is on the streets, and then we have limited resources. So who can we help? Do we have solutions for a particular group of individuals? Then with our outreach teams, we can go out and have those conversations with those individuals. We can track their progress. Does it start off with an ID? Does it start off with healthcare? Does it start off with getting them income? What do they need? And in order to track those little different pieces, we need to know who they are. And that's why this point in time count starts off with it's an important piece, which will kind of start this conversation, and then we'll be able to track better. And then once we can start to truly track stuff, then we can start to see, are we having success or not? Is that journey map that we showed earlier, is that working? Are people falling out of that system? Right? We need to have that data and information there. And this type of a system, like in number 2 there, starting to collect that data, not just from the city of Escondido, but from a county basis, we can start to see where other cities are having success. Where does the county have success? And so we can learn from others as well. So our goal is to do better tracking, so we can measure that success, so we can continue to go after that stuff. And when we're failing, we can pivot and go in a different direction.
So for the point in time count, like currently, that's not telling us how many people go through a program and get to the point of self-sufficiency, for example, right? It's not telling us how many people are perpetually in need. We're not getting that data from the point in time count currently, are we?
No, the point in time count is not going to give us, it's going to try to give us, for me, it's going to give us a baseline to move forward. We do have some numbers for certain programs, and some of these programs I run, we don't fund them all, so we're not involved in all the different programs, but they do track what's happening to individuals. And that's why in that journey map 2, we pointed out the long-term supportive housing is a key component to that, because at the end, if you just end up in housing without the services associated to that, and you're not ready for that, that's going to put you back on the street. And that's why we have a large chronically homeless population. So I think there is some failure happening somewhere in there. But do we have a good grasp on that? I don't know that we have a good grasp on that. Some of the professionals that really work in this area, they might have a much better grasp on that than I do. I don't know if anyone wants to chime in.
Can I say, we had this discussion at the last meeting as well. And honestly, we're just now getting everybody working in a more harmonious manner, right? I mean, we're just moving forward on that. And so like each group has some data. I don't know that we could actually put out, and we could say, well, this is good, this is bad, but knowing it in a holistic way, I don't think we're there yet. But I think that's the goal, right, Rob? Everybody's working towards that. Everybody's got some numbers, but they just don't know exactly whether or not that number has significance in terms of adjusting what our action should be. But the good news is, the cement's starting to dry a little bit, right? So I think we'll get there, but I don't think we're there just yet.
So I think it's also gonna be a combination, not just of the services and where's the money going, what services are we putting out, but ultimately you're gonna wanna see a reduction in unnecessary services. So folks that are justice involved, or how many arrests, or how many ER visits, or unnecessary hospitalizations. We're catching people well into their chronic illness. You know, and as we start to get a lot better than this, and we're sharing all that data, we should see all that go down. We should see even something basic like, you know, the number of breakfasts Interfaith serves every morning. Maybe they're at 150, 300 breakfasts a morning. Well, as those start to go down, we can start addressing things further upstream, right? And so when we get to the place where we're suddenly not having to pay for emergency room or a lot of the police involvement, the sobering mats, we go further upstream, and now we can provide you know, loans for kids to go to college, right? And give them that path much earlier on. Right now, we've got to solve this big issue here, but a lot of that, the other part of that complexity is that we've got to find a system that we can all share data. All of us have totally different systems that don't talk to each other, and that's a problem. Whether it's city, county, whether, you know, it's by healthcare, we have an electronic medical record. They have, you know, every social service agency has their own case management type system. We have got to find a way to get our systems talking. And I think that's where most of it is. So I do think there's some meat there in that, but it's you do have a very complicated question, right? But I think there are a lot of goals there, and I think there are a lot of data points that people are capturing. It's more than just, you know, how many apartments did we get, how many rapid rehousing funds. It's more than that. And what did people get? You have to see your bang for your buck, right? And so we would expect those other things to go down if we're successful.
The other thing I'd add to that is the data is what it is, and we are missing some stuff, but it's the conversations. It's getting everybody in a room like this and having some conversations around some of that data about some of the success that we're having, and really making sure that data has meaning. Otherwise, we could interpret the data wrong, or we could be missing some data points in there that we're not seeing, and that could be critical. So we're going to continue as a city is try to facilitate these conversations and really try to connect the dots, because we do need to know if we're being successful or not. Otherwise, we're blindly driving around in the dark, and who knows if we're going to get to our destination or not, if we're going to be successful, and that's not a good place to be.
I think too, the journey maps kind of can tell where services overlap, right? So I think there's definitely different services that do overlap, but that doesn't mean, you know, somebody might go to Education Compact because that's the agency that they feel comfortable with, and that's great, and we all encourage it, right? But I think it kind of shows, you know, if there's overlap, and I think it provides at least the first step, the vision of how people can get help. It also makes it, you know, anyone who doesn't know how to get help, if they can look on there and say, hey, I can go to Education Compact because they're serving, you know, they're serving a lot of youth in school, and that's where we're gonna get support. That's fine, because for us, well, we don't care which door someone comes in through. We just care that they're getting the services that they need to get.
So it seems like right now the website is really working as like a communication medium, as far as like, you know, this is the information we have, and like if anybody's interested, like they can kind of see what the conversation is kind of going on. I'm wondering if there's any way that we can kind of turn it into kind of like an action medium as well, as far as like, you know, if you're a resident that's looking already at the homelessness website, is there a link that I can click on that's like, I want to offer my volunteerism in the specific area of homelessness, and then from there I can kind of get plugged, or someone can get plugged in or connected with me, and or maybe even for somebody who needs these resources, instead of going on the website and seeing like a list of a bunch of different organizations, but saying, this is my situation, these are the kinds of services that I'm looking for, and then kind of like a calculator, getting plugged away, like, okay, well, these are the like service providers for the specific things that you're looking for in your area. I'm wondering if that's a possibility in some way.
It makes a lot of sense, and that's why I was so excited about creating this journey map, because it does give you the opportunity to say, here I am, right? Now, how do I get from here to here? But we also need to recognize who is going to be coming to our website. Is it someone who's on the streets? Probably not, but we still need to put some of that information up there, because we don't know where that conversation is going to start and who it's going to happen with. Somebody else could be looking at that and having that conversation. But yeah, if you want to volunteer, there could be definitely somebody come to our website. And so here I am, I want to volunteer, and you could choose some options, right? So I think a site that has a little bit more action behind it is definitely something needed. And we're about due to do some updates on it. So it's a good point. I appreciate that. Anybody have anything else you want to talk about? We still have a few more minutes. Yes.
One more perspective on the data question. I think the mayor's right. We're working towards having systems that are talking together to create the regional data goals that we need around reducing people experiencing homelessness. But we don't need to get there before knowing that we need more housing. We need more affordable housing, permanent supportive housing. So I think it's a very reasonable expectation for us to expect that communities set goals around how much additional housing we create. And so I would encourage everyone to, if that's something you believe in, advocate that we create more affordable housing.
How do we do that? Is it a matter of who we vote for or who we write letters to, or is there any specifics around that?
Well, Karen with the City of Escondido mentioned that the city is working with the housing developer to create more than 50 units of affordable housing for seniors. Half of it will be for seniors overcoming homelessness. Mm-hmm. So sharing your support for that with our city leaders, both staff and elected, is one way.
And sharing it locally, but also sharing it nationally, because a lot of our money comes from other sources. We put together combinations of federal monies and state monies and the old redevelopment funds in order to cobble together these projects, because we want these projects to happen, but we have to find funding from multiple sources to be able to.
Karen, give us like 2 minutes on the missing middle. It's not exactly affordable housing, but it addresses the housing issue and how, because let's face it, developers need to make money, right? They're not doing it out of the goodness of their heart. So just, I know. Sorry.
You just busted my entire bubble.
Tell about the missing middle.
So, one of the things that we find is market rate here in Southern California is dementedly high. Mm-hmm. And so the city is able to often cobble together packages so that developers are able to help low-income folks. But that leaves a huge amount of people as well who are earning between kind of that moderate range, between 80% and 120%. So 60%, $60,000 to kind of $110,000 still actually can't afford rent here. And these aren't people that are driven to homelessness, but these are people who are driven down market, who then push out people who then become homeless. So the City of Escondido actually recently worked with 3 different developers in order to buy existing housing to restrict that to those folks who are earning between kind of the $67,000 to $110,000, in addition to the work that we were doing kind of with subsidies to encourage developers to work with folks earning kind of much less than that as well.
But tell them where the developers get that money.
So for the missing middle, they bond, so they buy statewide bonds, but the city cooperates with them in terms of property taxes. And so they get breaks on their property taxes, which makes things a little bit more, which makes their worlds more affordable so that they can offer those rents.
When you're talking about rents, typical, they limit it to about 4%, right?
Yeah, so rent increases will be limited, so people will be able to be stabilized. It's one of the great
Whereas
things
now,
about
what are they doing,
housing.
10 or more?
It can be up to the change in the consumer price index plus 8% by state law. And then this missing middle, it'll be 4%. In affordable housing, it tends to be around 3%.
And the beauty of it is it's kind of a form of rent control, but it's not government imposed. It's the developer imposed.
Yeah.
So there are people who will be moving in there who will immediately get a 10% reduction in their rents. And then they'll be able to stay in there and then not kick out.
And then not kick out those people who are lower and lower and lower. Yeah.
Right.
So that's like in rentals, but what about like developers that are, doing condos or whatnot? I mean, is there a,
So in Escondido, what we've done is primarily we're able to work with organizations like Habitat for Humanity, who are able to work with low-income, potentially low-income homeowners. So people who are stable, all that they need is that help to be able to get an affordable mortgage. They can pay for it. And one of the things that amazed me back in the Great Recession, we had folks who were earning less than 80% of the area median income, and we had first-time homebuyers loans for people who are earning up to 120%. And those folks who are earning kind of those low-income folks will do anything to stay in their housing. Our loans made to low-income folks went bad at an extremely low rate. Kind of more moderate income folks, those loans went bad much more frequently. So low-income folks were really anxious to save and to keep the gains that they've been able to make. Yeah.
So kind of going back to where that whole kind of conversation started, like, how would I find out? Or how would anyone find out? Like, who's really advocating at the higher levels? Who are our friends in government that we should be voting for?
There are no.
Well, the politician said that. So HUD is one of the primary funders of housing. But the senators are the folks who really are the ones who push the federal budgets. The House of Representatives, there's so much more of them that any one voice is a little bit less powerful, and the Senate really controls HUD's budget. So, write your senator.
So we're kind of close to our time. I did, there's the volunteer thing, this we all count, the point in time count. So you can get the word out there if you know anybody who's interested.
That's important.
And having participated in that for the last 3 or 5 years, it's actually really nice for me to do that. As a private citizen, I get something out of participating in the point in time count. It's waking up at 3 o'clock in the morning, which is not my favorite time of day. It's when you're supposed to go to bed, not when you're supposed to wake up. But participating in it and knowing that that work informs what money is coming into the city and it brings resources in was extremely powerful for me. And I'd encourage anybody to do it. My 13-year-old did it with me 1 year as well. So it's a good thing and it's a powerful tool for us all.
Please help us get the word out. We need volunteers. So QR code on here, it's really simple to sign up. But Interfaith's going to be putting it on and they do a great job with that. So we really want to be out there and understand who are we trying to serve, who are we missing, who needs that help. So again, it does influence the funding that we do get and those types of things too. So we want to look into housing and those types of things. We want to do that. You know, we worked with Interfaith real closely and tried to go after some housing, and it just didn't work out. The real estate market was just crazy. We just couldn't find a solution. So we had a lot of funding. We had a lot of work that we put into it. And again, we're just going to continue to try, and that's all we can do is do the work that we're doing and make adjustments every chance we can, and keep learning from what we're doing and learn from what other people are doing, and keep making improvements and coming in groups like this and having conversations. And you'll go out and you'll have conversations, and then we'll circle back around and have more conversations, right? It's that effort that we put behind it that's going to make the difference at the end of the day. So I really thank you for being here tonight, especially with the weather going on. And I know there's others that were planning to come tonight and they didn't make it because of the weather, and I understand that too. So I know you all have families and other places to be. So it really means a lot to me that you guys made the time and made it here tonight. So thank you.
Hey, Rob, did you want to mention what our next CAG would be on?
Oh, sorry. You go back over to the PowerPoint. Yeah, so So our next one, March 8th, and we'll have, it's Escondido Cops Unit addressing homelessness. So we'll have a conversation on that area. That's our next focus, CAG meeting. So please kind of get the word out there. We'll be advertising this, and there's a lot of questions that come up around this as people see individuals out on the streets and see them in different situations and what's going on there. Why aren't we doing something about this? Or how are they helping? You know, because it's not just about enforcement, it's also about connecting them to services, right? So they do a lot of great work in this area, so we want to have a conversation around this. So, thank you.